Welcome to this NCFE video focusing on maximising exam success in the Health T level. In this video we'll look at specific examples of health multiple choice, short answer and extended response exam questions and provide you with some tips on how to support students to answer these questions. Multiple choice questions. Firstly, let's look at the specific example of a health multiple choice question. In epidemiology, which one of the following best describes the difference between incidence and prevalence? A. Prevalence calculates the decline in new cases and incidence focuses on the rise of existing cases. B. Prevalence focuses on using smaller relevant data, whereas incidence focuses on incidence creating data. C. Prevalence is the analysis of existing cases and incidence analyses new cases. D. Prevalence is the analysis of new cases and incidence analyses existing cases. This is a multiple choice biology question in relation to epidemiology. The question covers AO1, which requires students to demonstrate relevant knowledge and understanding of the context, concepts, theories and principles in healthcare. There is 1 mark for this question, so only one answer from the options is correct. Let's look at some tips on how to answer this question. Tip 1. Check what the question is asking to be addressed. This could be done by highlighting key words in the question. By highlighting the key words in the question, you can clearly see that you're looking for the answer that describes the difference between incidence and prevalence. Tip 2. Answer the question before checking the options. First, think about what incidence and what prevalence are in epidemiology. You may already know that prevalence is the analysis of existing cases and incidence analyses new cases. If you already knew these definitions when you check the options, it will be clear to see that option C, prevalence, is the analysis of existing cases and incidence analyses new cases is the correct answer. Tip 3. Rule out the wrong answer. If you're unsure of the right answer, look at the options and rule out the wrong answers. For example, you may know that prevalence and instances in epidemiology are about analysis of cases, which would rule out option A and B. You then have options C and D left. Reread the question to confirm that the question is asking for the difference between them, and if you were unsure of what they are in epidemiology, you may think about in general what prevalence means and what incidence means. Prevalence is about commonness and incidence is an occurrence of something happening. If you know what these terms mean in general, you could then reason what the best option in relation to epidemiology is. An incidence in general terms is about something happening. So option C would fit with this as it's about analysing new cases. Short answer questions. Let's now look at a specific example of a health short answer question. You're working in a hospital ward and have been asked to assist a female patient who is 4 hours post-op surgery. The patient needs to use the toilet. Due to the surgery, she is weak and unsteady on her feet. Identify one possible hazard and for this hazard give one way you could minimise the risk of harm. This is a short answer question in relation to health and safety in the healthcare sector. The first part of the question, identifying one hazard, covers AO1, which requires students to demonstrate the relevant knowledge and understanding of contexts, concepts, theories and principles in healthcare. The second part of the question, give one way of minimising the risk of harm, covers AO2, which requires students to apply their knowledge and understanding of contexts, concepts, theories and principles in healthcare to different situations and contexts. This is a 2-mark question with each of the parts of the question being awarded a mark for the correct answer. Let's look at some tips on how to answer the question. Tip 1. Find the command verb in the question. Within this question, the command verb is identify, which requires to name something. From the identify part of the question, the requirement therefore is to name a possible hazard. Information from the case study should be used to name the hazard. The case study provides the information that the patient is weak and unsteady on her feet, so the hazard could be them walking to the toilet as they may fall. For the second part of the question, you would use your identified hazard to think about how you could minimise the risk of them falling by walking to the toilet. This could be by them using a bedpan or taking the patient to the toilet in a wheelchair. Tip 2. Check what the question is asking to be addressed. This could be done by highlighting keywords in the question. By highlighting the keywords in the question, you can clearly see that you're looking for an answer that identifies a hazard and gives a way to minimise the risk of harm for that hazard. The requirement of the question is that you answer the first part before being able to answer the second part. Tip 3. Use the keywords in the question to answer the question. For example, one possible hazard is, and one possible way you could minimise the risk of harm for this hazard is. Extended response question. Finally, let's look at a specific example of a health extended response question. Discuss the practices used in hospitals for infection, prevention and control to comply with the control of substances hazardous to health, COSH Regulations 2002 and the Hazardous Waste Regulations 2005. Your discussion should include explanations of the regulations, the impact of not following these practices, analysis of the external factors that could lead to these practices not being followed. This is an extended response question in relation to infection, prevention and control in healthcare. It's a 9-mark question plus 3 marks for quality of written communication. The following assessment objectives are covered in the questions. A01. Demonstrate knowledge and understanding of context, concepts, theories and principles in healthcare. A02. Apply knowledge and understanding of the context, concepts, theories and principles in healthcare to different situations and contexts. A03. Analyse and evaluate information and issues related to context, concepts, theories and principles in healthcare to make informed judgments, draw conclusions and address individual needs. To gain marks in the top band for this question, students need to A01. Demonstrate clear and accurate knowledge and understanding of COSH Regulations 2002 and the Hazardous Waste Regulations 2005 with sustained focus. A02. Apply all relevant knowledge of COSH Regulations 2002 and the Hazardous Waste Regulations 2005 and how these regulations could be applied in practice to infection, control and prevention techniques. And for A03, evidence and informed analysis that is fully supported with rational and balanced judgments that consider the ineffectiveness of inefficient or inappropriate intervention. Further to this, students should provide a discussion that is comprehensive, effective and relevant, showing detailed, logical and coherent chains of reasoning throughout. For quality of written communication, students need to provide an answer that is clearly expressed and well structured, in which the rules of grammar are used, with effective control of meaning overall, and with a wide range of appropriate technical terms that are used effectively. Let's look at some tips on how to answer this question. Tip 1. Check what the question is asking to be addressed. By highlighting the content areas in the question, you can clearly see that you would need to show knowledge in your answer of infection, prevention and control. Control of substances hazardous to health, COSH Regulations 2002 and the Hazardous Waste Regulations 2005. Tip 2. Plan your answer. Use the notes section of the exam paper to plan how you will answer the question. You could include a table where you would note down what you need to include within your answer, covering all the command verbs and content areas within the question, to plan what you need to include in your answer. For example, for this question, you could make a table with the following headings. Explanation of COSH and hazardous waste regulations. Discuss practices in hospitals for infection, prevention and how these practices comply with COSH 2002 and Hazardous Waste Regulations 2005. Analyse external factors that could lead to these practices not being followed and discuss the impact of this. Tip 3. Composing the final answer. When composing the final answer, make sure the answer has a good flow and is structured in an ordered way. For example, for this question, you could structure the answer as follows. First, with an introduction in which you introduce what you will be covering within the answer. Next, an explanation of COSH regulations and the hazardous waste regulations. After that, a discussion of practices in hospitals for infection prevention and how these practices comply with COSH regulation and the hazardous waste regulations. Then, an analysis of external factors that could lead to these practices not being followed and a discussion of the impact of this. And finally, a summary in which you can summarise what you have discussed in your answer and draw conclusions. Check your spelling, punctuation and grammar throughout your answer, as this will also be assessed, so it's important to proofread your answer on completion. Use a wide range of technical terms within your answer. For this question, ensure that you include the key technical terms that are within the question and any technical terms in relation to the content areas. Thank you for watching this video, and I hope you found this useful in supporting students with preparing for exam questions.